Hello, everyone. My name is Terry O'Sullivan, and I am an associate professor in the University of New Hampshire, Manchester School of Security Studies. And I'm here to talk to you today about pandemics. And this is the first of two modules that you'll watch, the second of which is going to be talking specifically about United States COVID response. But in this, I want to talk to you about general pandemic response and what the issues are and the ideal ways that that occurs, both preparation and response. So let me start by going to slides and sharing this. So first of all, it's important to note that this has been around for a long time. Basically that, epidemics, pandemics have been around, and it's not unusual to see these things in history. But in modern history, we kind of have gotten less used to them, especially large-scale epidemics and even pandemics. And so this is one of the things that is unusual for Americans and for a lot of people around the world, that really since the 1918-1919 influenza pandemic, there's been nothing that really quite matches anything like this. And in some cases, this may indeed go on to surpass that pandemic, perhaps not in deaths. It killed about 30 to 100 million people, depending on how you look at it. But the disruption is without a doubt at least as great as the 1918 pandemic. So what's the issue between or beyond simple epidemics when dealing with a pandemic? The most important thing here is obviously to reduce the amount of health effects and quality of life and the like. Among other things, COVID, for instance, is going to cause significant reduction in quality of life for many people. There seems to be long-term effects from it. But also for pandemic response, you need to protect critical governmental systems and private sector systems, and obviously the medical and public health systems included, and to try to minimize the economic impact, just simply the medium to long-term economic and societal damage. One of the things I want to note is that global public health experts essentially believed that two major threats for pandemics existed, one of which was a new influenza virus that could cause a pandemic like it did in 1918. And the second was virus X. And essentially, we are dealing with the second. We're dealing with a COVID-19, a SARS-CoV-2 virus that is emerged from animals. It's made the species jump, as they say, and is now causing a pandemic. So there it is right there, and most of you know this, but this is the second after SARS-CoV-1, which occurred in 2003, with a far smaller impact, needless to say. But this is a brand new human virus. So how do you do pandemic preparation and response? Most important thing, as with anything, as with disease and injury and everything else in our lives, is prevention is far more important than reaction. So in other words, if you can prevent an accident or an epidemic or a pandemic from happening, it's far better than responding to it. And in this case, that would take the form of early detection or possibly even catching these things before they emerge into humans at a research level. But most importantly, if the outbreak begins among a cluster of people, to catch it early. And detection involves things like having hospitals be able to pick up on patterns, laboratories be able to do laboratory research to figure out what the if something is a brand new organism, a brand new pathogen, as they say, and then if an outbreak does occur, to catch it early. As you can see there, you're trying to prevent a small brush fire or a campfire from becoming a wildfire, because once it does, it's far more difficult to put out, as unfortunately the people of California in August of 2020 currently know all too well. So what do you do to counter a pandemic? So the countermeasures are really in two major categories. The first is pharmaceutical, kind of the modern vaccines, drugs, etc., that we all are familiar with, and many that we're not, obviously. And then non-pharmaceutical or non-medical countermeasures. So the object of all of this is to flatten the curve and to prevent an outbreak from being worse than it could be. But the main thing that you want to protect is overwhelming the systems, the hospital system, government, business, everyday life. And without protective measures, without countermeasures, these things can be significantly greater. And for instance, all of us have heard about overwhelmed hospitals that ran out of ventilators and didn't have enough staff or equipment and so forth. So even if the number of people who get sick in the end is the same, if you can spread that out, flatten the curve, it will help prevent overwhelming these systems and causing even more disruption than it possibly could. So non-pharmaceutical countermeasures, what are those? Hygiene. All of us know these really almost by rote now, whereas before COVID, most people didn't really think about these things, but hand washing and sanitation, making things that are cleaned, and sterilization and water purification and so forth. It depends on the disease, but in the case of COVID, we've all been taught these things. Social distancing also we're familiar with, trying to keep away from people who might be sick. This is particularly problematic if there are people walking around who don't have obvious symptoms or maybe even are asymptomatic. Also, obviously, you want to isolate the sick. Somebody's diagnosed. You want to prevent them from getting other people sick by keeping them separate, and then also potentially quarantining people who might have been exposed to sick people and might be possibly sick. Contact tracing is one of the age-old methods for public health response, which is essentially to try to track down who got sick in the first place, or at least who somebody who is sick is exposed to, and try to isolate them so they don't then take one and pass it on. And then, of course, we're also familiar with these basic public health measures that have gone back to well before the age of modern medicine, which can include closing society down at some level, limiting gatherings, and closing businesses, etc., as we all know. And also, in the modern world, there are non-pharmaceutical countermeasures and equipment like personal protective equipment that like masks, which now everyone is being urged to use. So some of the factors also that go into limiting and discovering the nature of a new virus that may cause a pandemic, or all of these things that you see up there. We've looked at many of these factors, and race has been a very big one. People of color have gotten sick at a higher level, much higher level. Males more so with severe disease, older people, inherited aspects of this are going to turn up, and then even things like pollution and basic general environment and habits, obesity, stress, all these things play a factor. So with contact tracing, as I noted, you want to essentially find out who has been exposed to those who are sick. And one of the most important aspects of this is being able to not just diagnose them as being sick, but also to test. And this obviously is a big part of modern society right now, the only way you really can know who is infected is by having the power of information, because otherwise, as I like to say, you are flying blind without these diagnostic abilities. And in an ideal situation, there would be instant tests where somebody would know if they were sick or not. That would make things much easier. But speed, reliability, and wide distribution to those who need it are all things which currently test our systems. So in terms of the structure of this, just briefly, the states are reserved the power for public health response for the most part. And this is true because of the 10th Amendment, which reserves the powers not granted to the federal government, to the states. And so that basically means that each state in the 50 states and territories has their own public health system and have the primary jurisdiction to deal with public health school systems, just as they do with schooling and the like. That can cause a little bit of chaos, but there's a long history of the states having this policing power to use these powers in public health emergencies at the local and state levels. Federal government, in turn, does have some jurisdiction on this, and particularly it has jurisdiction over the ability to regulate commerce between the states and interactions and what crosses borders, but also powers of the purse strings, that is to say funding, from various sources, congressional allocations and the like, but also in a general sense, advisory, organizational, and support functions. So the CDC doesn't tell states what to do, or the National Institutes of Health doesn't. They are there as advisory and support, and true for generally, and speaking for Department of Homeland Security, FEMA, the Small Business Administration, and Strategic Stockpile, which I'll talk about next time. So just really briefly, to wrap things up, this is what we're looking for with infectious disease epidemiology. If one person gets sick, if they can transmit it to others, then essentially those people can then transmit it to others. And this is just a way of looking at those. The first case is the index case, and then the primary case and secondary cases, and tertiary, third level cases, and so forth. And one of the things I want to note here in pink are these subclinical or asymptomatic carriers. And they can be particularly dangerous because if they don't know they're sick, and if nobody else knows they're sick, they can be walking around and infecting people, sometimes significantly, without other people knowing it. And that makes it even more difficult to do contact tracing and essentially to control an outbreak. And these subclinical carriers are, in particular for COVID, one of the greatest threats right now that we see, because many of the people who get COVID have mild cases, but nonetheless can pass it on to others, and sometimes they have no symptoms whatsoever. All right, I think I will wrap this up, and we will be talking next time, as I mentioned, about the aspects of actual response in the United States in particular, and how government and the private sector and individual citizens have done in responding to this.